there is a lot of confusion this year about the COVID-19 vaccine. Since the pandemic, COVID vaccines have been readily available at pharmacies and paid for by your insurance.
But administrative changes and resignations at the CDC, along with a different perspective on the vaccine by Health Secretary Robert F. Kennedy Jr., is changing all of that.
Dr. Andrew Jameson, who specializes in infectious diseases and specialty medicine at Trinity Health, sat down with me to explain what these changes mean for you.
So this means confusion. It just means confusion.
Dr. Andrew Jameson with Trinity Health says there are big changes with the COVID-19 vaccine for this fall. Sure, the vaccine itself was approved by the FDA to meet current strains, as vaccines are every year. But it's not the formula changing that's the issue.
What we're seeing now is, unfortunately, politics getting inserted into medicine.
The CDC has de-emphasized the COVID-19 vaccine, no longer recommending it for healthy children and pregnant women. The American Academy of Pediatrics, the largest professional association of pediatricians in the United States, is going against the CDC's recommendation for the first time in 30 years, still recommending the COVID shot this fall for children and pregnant women.
You have people that have an agenda, that have a certain perspective that is not shared by 99.9% of the healthcare providers in this country, and that's kind of being put out there, and it is going to impact health.
Many major pharmacy chains announced requiring a prescription for the COVID shot this year in more than a dozen states. Michigan, though, not one of them. But in many states, pharmacists cannot give vaccines not recommended by the Advisory Committee on Immunization Practices. And this year,
around a week before the new COVID recommendations were going to be made by the CDC, that entire panel was dismantled. And so those recommendations didn't come out right on that time.
It's still uncertain what getting a COVID vaccine will look like this season at pharmacies here in Michigan.
Access will go down. And unfortunately, that's the point of these recommendations.
The narrative around COVID vaccines could spread to other seasonal vaccines like the flu shot. Dr. Jameson said we already felt the effects of that last year when we had the lowest flu vaccination rates in many years.
It was the worst influenza season since 2004. We had more pediatric deaths last year than we've ever had on record in Michigan alone.
So what do you believe? Dr. Jameson acknowledges the COVID situation is not as dire as 5 years ago. Now it's important to have these conversations with your primary care physician or your child's pediatrician and find out what is best for you on a personal level.
Have that relationship, have that conversation, and really kind of taking it to the provider in front of you, because that individual has your best interest in mind.
And Dr. Jameson says Trinity Health has the COVID vaccines this year, but widespread administration has not begun. At this time, it's still unclear if insurance will cover the vaccine for everyone. Medicare should cover it for those over the age of 65.